until the almost the 1990s, women really couldn't elect to have a non-laboring cesarean. And I want to catch you up on how you got to this place where you can do it. And from our viewpoint as Birthing Better Families, we still believe that 100% of pregnant women will give birth one way or the other, and that it's an activity that you're going to do with your baby. And if you have skills to do this activity, you will birth better. You'll feel more engaged and more involved in this life transforming experience that has come from your being pregnant. Pregnancy itself is life transforming. That gateway from being pregnant to having a baby is also transformative. And so we encourage you to become skilled. And it's important for you to know how you have this choice. In 1970, when I gave birth, there was a 4.5% cesarean rate, and cesareans were major abdominal surgery, only done for mothers whose lives were at risk. It was major. You were knocked out, you were cut from the pubic bone to your navel. It took you a long time to recover. Babies had negative reactions to the woman being knocked out. If you got pregnant again, you did have a risk of a uterine rupture. It was major, but it saved women's lives. And the rest of us labored, whether we had a good birth or a bad, whether we found it easy or whether we suffered, whether we labored for hours or days, whether we had risks, whether those risks became problems, whether those problems became tragedies. And so what do we know from that? We know that modern women are risk averse. That's okay that we're risk averse. We just need to know that we're doing things because we're risk averse. Is it realistic to be risk averse? Well, yes, it is, and you kind of know it isn't. So if you go to the Center of Disease Control and look up the most common causes of death, you'll realize that we're sometimes risk averse for sort of the wrong reasons. So, for instance, every time we get in a car, there's a risk that we're going to be in a car accident. We may not die, but there's a risk we're going to be in a car accident. That's immediate, that's in your face. Not exercising, being in a stressful situation, having poor diets that produce the extended problems like obesity, diabetes, heart disease. We don't see those as risks because they're not immediate. However, when we're pregnant, we see birth as a potential risk. And it has always been a potential risk. But the risk isn't always about death. It can be injury, it can be suffering when women can't cope. So when my generation started to wear bikinis and we demanded not to be cut from the pubic bone to our navel, and the medical profession came up with bikini cuts, we knew that there was a risk of trying to have a vaginal birth after a cesarean, and that risk lowered when we had the bikini cut or the low-lying incision. So more women then could try to have a labor and have a vaginal birth after a cesarean. So we actually reduced the risks. So then the natural birth movement, where the medical profession easily and often and commonly used forceps, there was a risk to babies that they were damaged. There was a risk to a mother's vagina, that her vagina was damaged. But there was a risk when a woman pushed and she had tight vaginal tissue. There was a risk. There are risks. The risks don't always mean death. They can be injury. Those injuries can clear up, or they can be lifetime injuries. And what is an injury? Every woman who pees when she laughs or jumps or coughs, that may have been caused by a birth, straining at a birth. Is that a risk? Well, it is. Is that a problem? Yes, it is. So the reason that you can elect to have a cesarean is because in the 1980s, the natural birth movement wanted women to be able to choose. But their idea of choosing was that all women were going to choose to have less medical care, less assessments, less monitoring, less procedures, less births in the home. Less births in hospital. But when you say women should have choice, that means you should have the choice to have a non-laboring cesarean. And you should be able to have that choice just because you don't feel like you want to labor, or you don't feel like you want to have the pain, or that you feel that a vaginal birth is a greater risk to you or your baby. That's your choice. And birthing better families are going to support you. It's your choice. It's your family. It's your baby's birth. Your baby's birth is important to you. If you choose to have a cesarean and there are problems that arise, then you should have chosen, knowing that there are risks to yourself or your baby from having the cesarean. But with the reason also that we have more cesareans is that when the natural birth movement said that forceps can damage the baby or the mother, we shouldn't be using them, then the medical profession said, okay, it's less risky to a baby to be born by cesarean, so we're going to have more cesareans rather than using forceps. And that's what they do. If the baby is stuck in the vagina now, instead of doing episiotomies, forceps, or ventouses, they now push the baby back up and do a cesarean. Not always, but enough times that that has dramatically changed that. But that's still an unplanned cesarean or an emergency cesarean after laboring. That's not the planned cesarean that you're having now. So from a birthing better viewpoint, it's your body, it's your birth. We encourage you to learn the skills and to do some of the skills in pregnancy so you feel invested in the birth, because your body hormonally is still preparing to labor and have a vaginal birth. So you can take advantage of those hormonal changes, that nesting, that knowing you're going to have a baby. How do you become more engaged, involved in your elective cesarean, rather than feeling this is just a dentist date, but you're going to come home with a baby? So what we found is that women who engage more, fathers who engage more in preparing the body for birth, learning skills, using skills on the way to the hospital while being prepped and during surgery, felt more connected. They didn't have that disconnect that women and men have when they're having a non-laboring cesarean, that feels as though you're just going in to have a dental appointment and you come out with a baby. Women often feel disconnected because the hormones in the body have a purpose, and that purpose is to connect you through the activity of birthing your baby to your sense of being a mother or a father if the man is with you at the birth. So we encourage you to become skilled and use your skill, as so many birthing better families have with their elective cesareans, whether they wanted them, whether they felt pressured to have them, whether they're delighted to have them, or whether they absolutely feel devastated that this is what's going to happen. Be involved, be engaged, be skillful, and work through the moment-to-moment ability that you have as you breathe in and breathe out, and your body is in some posture position. It gives you rich moments, continued moments, from the time you leave your house to when your baby's in your arms.